हमें खुशी है कि हमारे विश्वविद्यालय में बायोटेक डिपार्टमेंट की डॉक्टर पी श्रीदेवी ने इस दिशा में बहुत महत्वपूर्ण कार्य किया है ICMR के प्रोजेक्ट से। और हम अब इस स्थिति में हैं कि सिकल सेल एनीमिया की आरंभिक अवस्था में ही हम जांच कर सकें। बहुत सामान्य सा टेस्टिंग किट बहुत ज्यादा प्रामाणिक। हमारा प्रयास होना चाहिए कि जिस क्षेत्र में भी, जिस गांव में भी, जिस अंचल में भी, जिस परिवार में इस व्याधि के लक्षण हैं, तो आरंभिक अवस्था में ही जांच कर ली जाए। हम आप सभी जानते हैं, आप इस विषय से संबंधित लोग हैं। इसमें जो ANM हैं, जो स्वास्थ्य अधिकारी हैं, स्थानीय स्तर पर, ब्लॉक स्तर पर, डिस्ट्रिक्ट लेवल पर, उन सभी की महत्वपूर्ण भूमिका होती है इस व्याधि के निवारण में और निराकरण में। इसके लक्षण के बारे में हम आप सभी जानते हैं। जिसके अंदर यह व्याधि होती है वह आरंभ में ही कमजोर होता है, विकास सही दिशा में नहीं होता, इन्फेक्शन का शिकार हो जाता है, जल्दी खांसी हो जाती है, सर्दी हो जाती है और बुखार हो जाता है। ये आरंभिक लक्षण है जिनकी पहचान बहुत ज्यादा है। कभी कभी कुपोषण के कारण भी व्याधियां होती हैं और विशेषकर सिकल सेल एनीमिया, जिसके बारे में कहा जाता है कि जेनेटिक डिजीज है। इसके निवारण के जो प्रयास होते हैं और जेनेटिक स्तर पर भी होते हैं, मेडिकल लेवल पर भी होते हैं और सोशल लेवल पर भी होते हैं। जिसे अभ्यास हो जाए उसको सामाजिक समर्थन की जरूरत है। सामाजिक समर्थन के दो आशय हैं। एक तो परिवार में उसका विशेष ध्यान रखा जाना चाहिए और तत्क्षण स्वास्थ्य केंद्र पर उसे ले जाना चाहिए। परीक्षण के उपरांत अगर पता चलता है सिकल सेल एनीमिया है तो इसका निदान हो सकता है। आजकल बताते हैं डॉक्टर साहब लोग, आप लोग से जो वैज्ञानिक जुड़े हैं, दो प्रकार का होता है, माइनर और मेजर। माइनर का समाधान है, इसके लिए बहुत औषधियां नहीं है। आजकल उसमें योग का भी प्रयोग किया जा रहा है और विशेष करके आंतरिक आत्मिक बल का विकास करके जिसे आप कैपेसिटी बिल्डिंग कह सकते हैं। जो मेजर है वो ज्यादा मायने रखता है। इसको लेकर के दो प्रकार की निदान प्रणाली है, इसे कैसे कंट्रोल करें और कैसे क्योर करें। कंट्रोल करने के लिए जो जीन थेरेपी है वो बहुत ज्यादा मायने रखती है, अथवा बोन मैरो ट्रांसफर जो बड़े स्तर पर किया जाना चाहिए और ज्यादा गैर साध्य है। इसलिए इसके लिए कुछ और भी उपाय किए जाते हैं समाज में सामान्य रूप से, जो हम लोग घरों में कर सकते हैं। बहुत ज्यादा पानी पी लेना चाहिए। एक बहुत सी छोटी सी दवा है, आप लोग जानते हो, फोलिक एसिड, इसका भी प्रयोग कर लेना चाहिए। अथवा समय समय पर ब्लड ट्रांसफ्यूजन ये होना चाहिए। लेकिन बड़े स्तर पर होते हैं, जैसा चिकित्सक लोग बताते रहते हैं। सामान्य तरीका ये है कि जिस परिवार में सिकल सेल एनीमिया हो, जो डॉक्टर पी श्रीदेवी ने इसका टेस्टिंग किट डेवलप किया है उसके माध्यम से पता हो जाए, तो ऐसे परिवारों में सामाजिक संबंधों के समय भी थोड़ा विचार करना चाहिए। इन्फेक्शन अगर होता है, सर्दी जुकाम मलेरिया बुखार, आप लोग जानते हैं कि RBC, WBC, ब्लड प्रेशर, सारी चीजें जो हमारे रुधिर तंत्र को पुष्ट करती हैं, उस पर इसका असर होता है। विशेष करके रेड ब्लड कैप्सूल पर जिसे RBC कहते हैं, या रक्त कणिका, लाल रक्त कणिका जिसे कहते हैं, उसमें ऑक्सीजन की कमी हो जाती है, फिर शरीर टेढ़ा होने लगता है। ऑक्सीजन की कमी को पूरा करने का जो दो उपाय है, एक तो बहुत ज्यादा पानी पीने की शरीर में ऑक्सीजन की मात्रा अंदर से बैलेंस हो, और दूसरा आजकल बताया जाता है योग के माध्यम से भी हम ऑक्सीजन की मात्रा शरीर में बढ़ा सकते हैं और प्रकृति के बीच में रह करके यह ज्यादा संभव है। लेकिन इसके लिए आरंभिक तैयारी होनी चाहिए। यह शिक्षा और चिकित्सा दो तैयारी इसमें मायने रखती है। इसको किसी भी प्रकार के विश्वास से नहीं जोड़ना चाहिए और ऐसा नहीं मान के चलना चाहिए इसका निदान नहीं। ये जो आज कार्यक्रम हम लोग कर रहे हैं, इसमें हमें बताना है कि लाइलाज बीमारी नहीं है, इसका सुनिश्चित निदान है और सभी को टेस्ट कराना चाहिए और इसके लिए भी टीकाकरण विकसित हो रहा है, कुछ विकसित भी हुआ है। तो वैक्सीनेशन भी होना चाहिए उन क्षेत्रों में जहाँ सिकल सेल एनीमिया की कार्यग्रस्त लोग पाए जाते हैं, स्क्रीनिंग टेस्ट होना चाहिए। परीक्षण बहुत ज्यादा आवश्यक है। अगर रोग के लक्षण पता चलते हैं, जांच में पता चलता है कि सिकल सेल एनीमिया है, तो फिर निवारण बहुत आसान हो जाता है। और इसके लिए जो डॉक्टर पी ने किया है, ग्रामीण स्तर पर भी जागृति गांव के लोगों से मिलना, आंगनबाड़ी कार्यकर्ताओं से मिलना, जो स्वास्थ्य सुविधाओं में आशा कार्यकर्ता है उनसे मिलना, लोगों को बताना, उनके बीच में जाना और उन्हें स्वास्थ्य केंद्र तक लाना, यह ज्यादा महत्वपूर्ण है। कैपेसिटी बिल्डिंग का आशय यही होता है कि निदान की सारी सुविधाएं वहां पहुंच जाए जहां के लोग इस प्रकार की समस्याओं से बच सकें। सिकल सेल एनीमिया का भी निदान होगा, साथ साथ और भी जो कमियां हैं, विशेष करके पानी की जो गड़बड़ी है इस क्षेत्र में, उस पर भी काम होना चाहिए। तो लोग ज्यादा स्वस्थ रहेंगे। स्वच्छ जल, पौष्टिक आहार, नियमित स्वास्थ्य की जांच, यह तीन कैपेसिटी बिल्डिंग के लिए बहुत ज्यादा आवश्यक है। और जो हम इसमें इम्प्रूविंग द कैपेसिटी ऑफ हेल्थ सिस्टम कर रहे हैं, इसके लिए बहुत ज्यादा आवश्यक है। ICMR का जो प्रोजेक्ट है बहुत ज्यादा महत्वपूर्ण है। स्थानीय स्तर पर जो हमारी उपलब्धियां हैं, इसे राष्ट्रीय स्तर पर ले जाने की जरूरत है। हिंदुस्तान से इस व्याध का हम निर्मूलन करने में सफल हुए। मुझे पूरा विश्वास है कि आप लोगों के सहयोग से, आप सबके प्रयास से और नियमित लोगों के बीच उपस्थिति से हम इस रोग के निवारण में पूर्णतः सफल होंगे। हमारे विश्वविद्यालय में इसको लेकर के बहुत महत्वपूर्ण कार्य हो रहे हैं। हम चाहते हैं जिसमें जिला प्रशासन के साथ इस पर चर्चा हुई है, मिल करके काम हो रहा है और यह जो काम हो रहा है इसका प्रतिफल है, जो रिपोर्ट है, यह पार्षद मीटिंग में भी उपयोगी होगी। और ICMR की जो योजना है पूरी दुनिया से हम इस व्याध के निवारण में उपयोगी हो सके, तो निश्चित रूप से हम सभी इसमें सफल से आप सभी एक महत्वपूर्ण कार्य कर रहे हैं। आज के आयोजन के लिए डॉक्टर पी को, उनकी पूरी टीम को और जो लोग इसमें प्रतिभाग कर रहे हैं, उन सभी को बहुत साधुवाद बधाई और मेरी ढेर सारी शुभकामनाएं। हमारे प्रधानमंत्री जी का मिशन है स्वच्छ भारत, स्वस्थ भारत, समर्थ भारत। व्याधियों के निवारण से ही हिंदुस्तान स्वस्थ होगा और स्वस्थ भारत ही समर्थ भारत होगा। आप सभी इस लक्ष्य को पूरा करने में सफल हों, मेरी ढेर सारी शुभकामनाएं। और
सर बहुत बहुत धन्यवाद सर, and thank you so much for always encouraging us at IGNTU to do such a project for the tribal area. हम लोग आपके बहुत बहुत आभारी हैं सर। एंड ये प्रोजेक्ट हमारे लिए बहुत ही महत्वपूर्ण है सर। एंड ये हम पूरे अनूपपुर डिस्ट्रिक्ट में करना चाहते हैं, जो कि हमने 4 ही PHC में अभी तक किया हुआ है सर। थैंक यू सो मच सर, आप हमें हमेशा हमें ऐसे ही सपोर्ट करते रहें। आपको बहुत बहुत धन्यवाद सर आपके आशीर्वचनों के लिए। थैंक यू सो मच सर। थैंक यू सर। आज हमारे लिए बहुत ही महत्वपूर्ण दिन है। दिस इज अ वेरी इंपॉर्टेंट डे फॉर अस बिकॉज टुडे जो in which project we do not know any ASHA or ANM of the area. Today ASHA, ANM, LTs, medical officers, CMHO तक के हमारे साथ हैं एंड हमारे साथ जुड़े हुए हैं, क्योंकि हम लोग गवर्नमेंट हेल्थ सिस्टम, हम लोग गवर्नमेंट के साथ चलते हैं और गवर्नमेंट के साथ काम करते हैं। सिकल सेल के प्रशिक्षण के लिए हमने ये प्रोजेक्ट में काम किया है। चलिए सुनते हैं हम विद आवर हेड SBHSR डिवीजन। एक्चुअली ये प्रोजेक्ट का आइडिया क्या था, सर ने इसको किस तरह हम 6 PIs को कैसे मेंटोर किया है and how he has got this project to a level where it is being now heard every day. I think I am sure NASCO will agree with this. Sir, please sir, Dr. Bonta will ask. Over please.
Yeah, good evening everyone. I would like to convey my regards and thanks to Professor Prakash Mani Tripathi sir for not only for presiding this function and also for his support to conduct this study in Anuppur district. And also we wish and we seek his blessings and support toward this project and also for the coming project also. Also I would like to thank Ms. Sonia Meena, the collector of Anuppur district, and from NHM of Madhya Pradesh, Dr. Ruby Khan, Dr. Achha Mishra. I hope they are present in this meeting. I convey my thanks to them. And also District Medical and Health Officer of Anuppur, Dr. Rai, and friends Gautam Dongre from NASCO, Sri Prabhat Sinhaji from Pfizer, of course the Sridevi, the faculty of the Department of Biotechnology. I thank all of you for their presence as well as for their support. The main purpose, already Dr. Sridevi mentioned that, is to highlight the purpose of conducting this study across six states in country. That is the feasibility of screening as well as managing this disease by the local PSC system. This is the main aim of this project. Why we took this study and why we want to demonstrate the feasibility of this study, highlighting the feasibility of screening as well as the treatment at PSC level, because till now we have some myths about sickle cell disease. Of course, the first is not only the myth, it is the what you call history in the country, that most of the research, if you go through various studies across the country or various interventions taken up by the state governments, it is limited to screening. Wherever, even today also many people are talking about we'll screen entire state, we'll screen entire Assam, we'll screen entire Madhya Pradesh. So we believe that just screening is not enough. That is one of the purposes of this project, to demonstrate that simple screening and telling that you are suffering with this disease is not enough. Second is, many people have the perception that only the treatment is available only at tertiary care hospitals, and the patient diagnosed as sickle cell disease or sickle cell anemia has to go to the tertiary care hospital or a hematologist. Okay, so a normal doctor, a normal MBBS doctor, a normal PSC doctor can't treat it. These are all the myths. So we want to break that myth and say that yes, the doctor at a primary health center, the doctor at a primary health center at a remote tribal area can manage the disease, can treat the disease. This is the aim of this project. And also I would like to draw your kind attention to the fact that what is the situation of tribal areas and what is the situation of tribals, what is the socioeconomic condition, what is the literary levels. Okay, if a screening team come to your village and say that yes, you are suffering from this disease, and you go to the tertiary care hospital in Amarkantaka, Bhopal or Raipur, okay, what is the outcome or what is the reaction of these poor tribal people? If we are not able to address the problem of the tribal people, in which the disease is very prevalent, the sickle cell disease is very prevalent, okay, just simply by screening and telling that you go to tertiary care hospital, because I believe that our system is failing at some point of it is failing in fact. Okay, it is not only the highlighting the problem or not only saying that you are having the disease, our system is able to treat them. So with these intentions, particularly by considering the socioeconomic and other health system related issues of the tribal population in remote areas like Madhya Pradesh, Assam, Andhra Pradesh, Gujarat, Karnataka, in these states, we believe that and we thought that we have to develop a system, we have to develop a model of comprehensive sickle cell disease care for the poor tribal populations. This is the intention of the project. With that aim, we conducted this study in 6 states, but of course we have taken the small populations of 2 PSCs at each district, and we could demonstrate that the screening is possible. First and foremost is the screening is possible by involving the ASHAs as well as ANMs. Okay, I think Dr. Sridevi is going to make a presentation very clearly. Okay, we developed a 3-tier model of screening. Okay, which starts from the ASHA workers, then the suspected patients will move to the sub-health centers, that is where ANM reside, and ANM will confirm through the solubility test, and finally the final confirmation will be done at the PSC. Okay. For this, we developed the capacity of the all the system. That means right from the ASHA workers to PSCs. Okay. Now in PSCs, our lab are able to cell diseases, sickle cell disease, and similarly at sub-center level they are able to identify the suspected cases, and at ASHAs also are able to identify the people who are having some symptoms of the disease. So like that, with the 3-day system, we developed a model of screening. Once the screening is established and we find the patients, we are sending them to the PSC for treatment, and the doctors who are treated were trained by, are oriented by an hematologist, and now they are very comfortable in treating sickle cell disease patients. They are prescribing all the drugs which are standard for treatment of sickle cell disease, like they are prescribing hydroxyurea, they are giving ferrosulfate, folic acid to address the problem of anemia, and simultaneously they are giving pain management like paracetamol, diclofenac, or ibuprofen, whatever is appropriate there, and also they are giving antibiotics to prevent different kinds of infections, and also vaccines also we are able to provide at PSC level. Earlier, all this treatment, all these whatever I listed out now are available only in the tertiary care hospitals or medical college hospitals. But we demonstrated that yes, these treatment which are standard for treating sickle cell disease are available at PSC level. See, medical officer is able to do this treatment. Earlier it was a dream, and also even today also many people may not be, they may not like to accept it, though it is feasible, because of various reasons and various intentions. But our project demonstrated that with a simple orientation and simple training, our medical officers who are working in peripheral level, particularly in primary health centers, are able to, at least I can say, more than 90% of the cases of the sickle cell disease. Because there may be very few cases of sickle cell disease where there will be emergencies like need of blood transfusion and other issues. But majority of cases, majority of the sickle cell cases can be treated with simple drugs, which I have been listed. This is a very clear message which we want to send across the country, that we need not depend on the tertiary care hospitals and medical college hospitals. Our system, our primary health system, our government health system is able to manage this disease and able to decrease the burden of the disease across. Because you know the pain and suffering these people face. Okay? Because anybody like Dr. Gautam Dongre and others can narrate what kind of pain people suffer. Because second issue which I highlighted earlier also, that if this is an urban population, if it is an affluent population, a rich population, rich people, okay, their situation is different. They can afford, they can go to hospitals, their health-seeking behavior is totally different. But the poor tribals, okay, after identifying that you are suffering from this disease or you are affected by this disease, and the system is leaving them to God, it is not justified. So, being a welfare country like us, it is our responsibility to show some way for this poor people. And our public health system, we have robust primary health care system in our country, and if we cannot address the problem of tribals of this kind, I believe that it is very injustice. Right? Another thing which we as I mentioned, that the feasibility of screening is possible and treatment of patients is also possible through our medical officers at PSC system, and also routine care even for other issues like psychosocial support, counseling for marriage. All these things also can be possible through our ANMs as well as ASHAs, because we have big network of ASHAs and ANMs. We have to realize that one. So their services also should be used for the management of the disease. And the capacity building, because in our project we demonstrated that the capacity building is possible with very, very, very low financial efforts. Okay, we need not spend huge crores or crores. with the very, very cheapest instruments. Electrophoresis altogether will be less than 2 lakhs. If each base is having a electrophoresis unit, they are able to screen the patient. Similarly, the kits for solubility tests, initial screenings are also very cheaper. So we demonstrated that if A&M can identify the suspected cases and ultimately those cases can be confounded PSC. So these are all very cheapest and technologically simple techniques. Okay, they are not complex because many times we ourselves underestimate our technicians and our staff. See, because if a malaria, if you many of you know that how malaria, what you call microscopy is so skill based, because everyone can't identify the malaria parasite under microscope. Our lab technicians are able to do that kind of work. If they can able to do such kind of work, why can't they do the sickle cell anemia screening? It is a very simple technique. So we captured this kind of issues and we developed a model of screening and treatment in our public health primary health care system, and we found it is feasible and it is successful. This we want to convey in, and also we are going to scaling up this program again in these districts. Now we are taking the entire district as a unit of intervention. So we would like to see at least out of the 6, 4 or 5 districts will be taken again, and we implement this program with additional components. And also we are trying to incorporate other hemoglobinopathies like thalassemias and HBE, because in some states HBE is prevalent. So that kind of, in future we will incorporate these other hemoglobin variants or other hemoglobin problems into this program, and then it will be a more comprehensive. And also we would like to, in earlier study we have not included the psychosocial support to the patients. In this scaling up program we would like to add that component so that ultimately it will be a very comprehensive sickle cell disease care or program. Okay, this is actually the lessons we learned from this program, and also we would like to disseminate these lessons across the public health system as well as the not only the government system but also to our what you call advocacy groups, patient groups, even academicians. Okay. This is our intention of this meeting, and I hope that Dr. Sridevi will elaborate whatever the issues I highlighted, and ultimately I request all of you that please break some of the myths about sickle cell disease. It is the disease which can be managed locally by primary health system. They may not go for very sophisticated or high-level hospitals and high-level tertiary care hospitals, medical college hospitals. It is not required. We demand for the treatment locally. Our tribal populations, tribal leaders, tribal villages, or advocacy groups should be able to highlight that it is possible at local level, that is by the local PSCs. This is our dream, to make the PSC care. PSC should be able to provide the care for at least the maximum number of patients at locally. Okay, with this I stop here, and again I request all of you to support this study, particularly the district administration of Anuppur district and NHM officials of Madhya Pradesh and Honorable Vice Chancellor sir also, to continue our studies in Anuppur district. Thank you very much for giving me this opportunity.
Thank you so much, sir. That was really very simple and very brief thing about our project. In fact, I want to tell everyone that we are very, very fortunate to have sir as our mentor and guide for this project, because his idea of reducing the economic burden on the sickle cell patients in the tribal areas, it was the main idea before this to start this project. And sir has really mentored us. Almost every month we had review meetings and everything in order to take the project in the right direction. And we are today seeing this day where we feel so proud and successful in Anuppur district and also in all other sites. Today is an important day once again, because today we have not only medical officers, patients, and the district health system with us. We also have our ASHA and ANM who have supported this project from Anuppur district with us in this meeting. Thank you so much, Babu sir, for such a briefing. And now, before I give a small presentation on this project, I want to show a small documentary of 4 minutes 50 seconds, how this project we have started and how we have done. Please have a look.
भारतीय आयुर्विज्ञान अनुसंधान परिषद नई दिल्ली द्वारा वित्तीय सहायता प्राप्त इंदिरा गांधी राष्ट्रीय जनजातीय विश्वविद्यालय अमरकंटक द्वारा संचालित सिकल सेल रोग प्रशिक्षण और प्रबंधन के लिए भारतीय आयुर्विज्ञान अनुसंधान परिषद नई दिल्ली द्वारा वित्तीय सहायता प्राप्त इंदिरा गांधी राष्ट्रीय जनजातीय विश्वविद्यालय अमरकंटक द्वारा संचालित सिकल सेल रोग प्रशिक्षण और प्रबंधन के लिए स्वास्थ्य प्रणाली और समुदाय की क्षमता में सुधार परियोजना एक राष्ट्रीय कार्यदल परियोजना है। इस परियोजना में देश के 6 केंद्रों सहित मध्य प्रदेश के अनूपपुर जिले में सिकल सेल प्रबंधन पर अध्ययन कार्य किया जा रहा है। परियोजना अन्वेषक डॉक्टर परकी पंडला श्रीदेवी के निर्देशन में यह परियोजना संचालित है। परियोजना के प्रथम चरण में अमरकंटक, बेनीवारी, घाटा तथा कोयलारी प्राथमिक स्वास्थ्य केंद्र के कुल 32 गांवों में 1640 लोगों का घर घर जाकर के सर्वे किया गया। साथ ही समुदाय के मुखिया, स्वास्थ्य कार्यकर्ता, वैद्य और चिकित्सकों का भी साक्षात्कार किया गया, जिसका मुख्य उद्देश्य लोगों में सिकल सेल एनीमिया बीमारी की जागरूकता का स्तर जानना था। इस सर्वे और साक्षात्कार का निष्कर्ष यह रहा कि क्षेत्र के ज्यादातर लोगों को इस बीमारी के बारे में जानकारी का अभाव है। चारों प्राथमिक स्वास्थ्य केंद्र के चयनित आंगनवाड़ियों में सिकल सेल बीमारी का प्राथमिक जांच सिकल सोल्युबिलिटी जांच किया गया। प्राथमिक जांच में पॉजिटिव आने वाले बच्चों का ब्लड सैंपल लेकर कंफर्मेटरी टेस्ट के लिए भेजा गया। ICMR के द्वारा पूर्व में किए गए अध्ययनों के अनुसार क्षेत्र में सिकल सेल रोग का प्रसार 0.7% है। वहीं नेशनल टास्क फोर्स प्रोजेक्ट के द्वारा वर्तमान में किए गए रैपिड सर्वे के अनुसार यह आंकड़ा 4.0% का रहा है। आइए देखते हैं कि सिकल रोगी को किन समस्याओं का सामना करना पड़ता है।
जी, आपको सिकल बीमारी के बारे में कब पता चला, क्या क्या तकलीफ होती है इस बीमारी में?
मेरे को सिकल बीमारी का पता चला 2 साल पहले। मेरे को सिकल बीमारी में बहुत सारी तकलीफ होती है, जैसे दर्द, बुखार, पीलिया, जोड़ों में दर्द और छाती में भी दर्द होती है और पीलिया हो जाती है, सांस फूलने लगती है और जैसे ठंडी मौसम में आंकड़न आती है और काम करने की इच्छा नहीं होती है।
परियोजना अंतर्गत चयनित गांवों में फोकस ग्रुप डिस्कशन का आयोजन किया गया। इस पे समाज के विभिन्न पेशा से जुड़े लोगों को एकत्र कर सिकल सेल के जागरूकता और प्रबंधन के विषय में गहन चिंतन, विचार विमर्श तथा संभावित सुझावों का चर्चा किया गया। इन समूह चर्चा में सिकल सेल रोगी तथा उनके परिजनों को भी आमंत्रित किया गया ताकि विषय की गंभीरता को करीब से समझा जा सके। परियोजना द्वारा स्वास्थ्य क्षेत्र से जुड़े वैद्य, स्वास्थ्य कार्यकर्ता, ANM, लैब टेक्नीशियन तथा चिकित्सा अधिकारी का साक्षात्कार किया गया।
हमने एजुकेशन के दौरान सिकल सेल डिसीज के बारे में जाना है, लेकिन PSC अमरकंटक में सिकल सेल्स का टेस्ट होता है, लेकिन उसका कंफर्मेशन ना होने के कारण से पेशेंट को बहुत सारी परेशानियों का सामना करना पड़ता है, जिस कारण से पेशेंट परेशान होते हैं और उनका कंफर्मेशन टेस्ट नहीं हो पाता है। बस यही है कि PSC अमरकंटक में कंफर्मेशन टेस्ट होने लगे तो पेशेंटों की काफी सुविधा हो जाएगी।
प्राथमिक स्वास्थ्य केंद्र तथा उप स्वास्थ्य केंद्र स्तर में सिकल सेल एनीमिया का प्राथमिक जांच उपलब्ध कराने के उद्देश्य से उप स्वास्थ्य केंद्रों में कार्यरत सभी ANM को सिकल सोल्युबिलिटी टेस्ट का प्रशिक्षण प्रदान किया गया। अमरकंटक प्राथमिक स्वास्थ्य केंद्र के अंतर्गत आने वाले 9 उप स्वास्थ्य केंद्रों के, वही बेनीबारी प्राथमिक स्वास्थ्य केंद्र के अंतर्गत आने वाले 13 उप स्वास्थ्य केंद्रों के सभी स्वास्थ्य कार्यकर्ताओं को बेनीबाली में सिकल सोल्युबिलिटी टेस्ट का प्रशिक्षण उपलब्ध कराया गया। परियोजना द्वारा उप स्वास्थ्य केंद्र स्तर में ANMs द्वारा सिकल सोल्युबिलिटी टेस्ट किया जाएगा, जिसमें पॉजिटिव आने वाले व्यक्तियों को प्राथमिक स्वास्थ्य केंद्र में भेजा जाएगा, जहां 2 ml ब्लड लेकर कंफर्मेटरी इलेक्ट्रोफोरेसिस टेस्ट कर रोग की पुष्टि की जाएगी। प्राथमिक स्वास्थ्य केंद्र, उप स्वास्थ्य केंद्र, आंगनवाड़ी तथा समाज व समुदाय में सिकल सेल एनीमिया रोग के प्रति जागरूकता को जानने के उद्देश्य से पोस्टर, पंपलेट, बैनर आदि का उपयोग किया जा रहा है।
So that was it. Actually, there is an elaborate documentary of how we have worked in the intervention PHCs and the control PHCs. This documentary was made just after the formative research and when we have started the intervention, and how we were going to do the intervention with the IEC material, and also how we were going, we finished the training of ASHA and sensitization of ASHA and solubility test screening of ANM. Then we have given training to the lab technicians for electrophoresis. That was it about the documentary. There is one YouTube link which I will be sharing with you all now in the chat box, where we have made a documentary of the whole thing, how we have done it. टाइम के अभाव के कारण हम लोग नहीं कर पा रहे हैं। अभी मैं अनुरोध करती हूँ, आई वेलकम डॉक्टर रूबी खान मैडम, Deputy Director, Blood Cell, NHM, Government of Madhya Pradesh, to give her few words about this project and also Sickle Cell in Madhya Pradesh. And also, I just want to introduce her. She has been working on sickle cell for the betterment of treatment of sickle cell patients, and also for the sickle cell disease in Madhya Pradesh. And she has been doing a wonderful job. I congratulate Madam for that, and I thank Madam for giving her time for our dissemination of this project. Ma'am, we could not meet you or talk to you regarding our project, but you are being very kind to give us this time. I welcome you, ma'am, for this program. Dr. Ruby Khan, ma'am. I think there is some connectivity problem. Okay, before ma'am just gets on to the board, I will be presenting for 2 minutes about the project. I'll be quickly going through my slides, telling you about how this whole story has started. Actually, this was, as I told you before, this was idea of head SBHSR division, that the tribal areas do not have access to the government healthcare system, and specifically the tribal areas are more affected with the sickle cell disease. This was there was a pilot study of ICMR itself in Madhya Pradesh also, which tells that it is at least 0.7% of burden in tribal areas of Madhya Pradesh. And then, in order to increase the access of the government healthcare system itself for the sickle cell patients, all this idea was started. So the main rationale or the main aim of the project is to develop effective intervention model for sickle cell disease patients for accessing government healthcare system, and also the capacity building of different levels of health system for the sickle cell disease, and also for the improvement of knowledge and awareness of sickle cell disease among tribal population. So this study was taken up in 3 phases, that is formative stage, the phase, and then intervention, and then evaluation. In formative, it was designed for community related and then health system related. In community related, we started with the understanding of if the community has any understanding of sickle cell disease and how was the treatment seeking behavior. And in the health system, specifically the assessment of their skills and what are the infrastructure, what all infrastructure is available for the in the PHCs and in the SHCs for sickle cell disease. That was assessed in the formative research. That was done in mixed methods approach, that is by quantitative survey tools and also by qualitative survey tools. In the quantitative, we have done a household survey. In the 4 PHCs, we have taken 2 PHCs as intervention PHCs and 2 as control PHCs. But we have done the household survey in all the PHCs, and then we have done qualitative survey tools like in-depth interviews of key informants, in-depth interviews of medical officers, health workers, in order to know the knowledge and also their skill for sickle cell disease. And then we had a training of given by our mentor Dr. Bontavi Babu for all the research staff and also for the PIs for the using the tools and also testing of the sickle cell disease at Amarkantak. And then we started our study with a rapid survey. We have done a rapid survey in Anganwadis, and we found that there is at least a 4% burden in the Anuppur district. And then with the household survey results, we have found that there is a very little knowledge of sickle cell disease in the community, and it needs needs the intervention, and hence we have started this study. And then we have done some in-depth interviews with traditional healers, because all the tribal people in these areas prefer traditional healers for any pain or any disease. And do they know about sickle cell disease? That was our aim. And then we have done some in-depth interviews with the key informants, and also we have done focus group discussions in the villages and also with the village heads to know about the social stigma towards the sickle cell patients in the community. And we have done some in-depth interviews with health workers, pharmacists, and medical officers, and also we have done observation at SHCs and PHCs if they have the equipment needed, or do they have the capacity, or do they have the skill needed for the sickle cell disease. And then we have gone for our second step, that is intervention, the core principles of intervention for inclusive partnership, capacity building, community mobilization, and SCD care. Under this, we have taken up advocacy efforts, which we have, under advocacy efforts, we have spoke to district administration and also district medical. We have taken help and support of district healthcare system using the formative research findings. And then we have done the capacity building by training the ANMs for solubility test, and Ashas. We have sensitized the Ashas that they can pick up the sickle cell disease patients from the community based on just the symptoms. We have trained them on symptoms. We have sensitized them for sickle cell disease symptoms. And then we have developed some IEC material with which the community was mobilized to go to the SHCs for solubility test. And the ANM does the solubility test in the SHC. That was the whole idea was that the ASHA will pick up the symptomatic patients and send them to the ANM or the SHCs for solubility test. The solubility test was done, and then the positive patients were sent to PHCs for confirmatory test. Then we have done the capacity building or the training of the lab technicians in the PHC, so that they use the equipment like cellulose electrophoresis and confirm that if it is a sickle cell patient, is trait or a disease patient. And then a registry was developed at central level, that is by ICMR, so that the patients are registered and their follow-up also is taken care. So in that way, these were the advocacy efforts we have done, and we have also, in this we have spoke to the government healthcare system, disease experts, NGOs, and we have spoke to NASCO, Tribal Welfare Department, and we have taken help and support from all these organizations for the effective running of this intervention. Then IEC activities we have done in the community, in villages, markets, tribal fairs, health camps were conducted along with NGOs, and then schools and Nukkal Natak was organized, and then football and cricket matches were also organized. And basically the training was given to ASHA for sensitization, ANM solubility test, lab technicians for HB electrophoresis, and medical officers for disease management, and also for counseling of the patients, and also for the program sensitization by the medical officers, and also for the treatment of sickle cell patients. So these were the different things done, and we have also done an international colloquium last year on sickle cell disease, in which we have spoke to different organizations at international level and hematologists and policy makers regarding the capacity building in India based on this pilot project. And we have also developed, as I told you, a registry of sickle cell patients. And during evaluation phase, we have seen that we have done the impact assessment in both control PHCs and also in the intervention PHCs. These were the different tools used in the evaluation phase. And at last, what we have come to a conclusion, the sickle cell patients were, total number of whatever sickle cell patients were identified were 99% belong to scheduled tribes and were unable to reach the government healthcare system. And then we have understood that in control PHCs, people did not have any knowledge, and neither they reached the government healthcare system. Whereas in intervention PHCs, after our project has worked, people started going and getting tested, and we have given those in the report we have given how many patients. Almost some 2,000 patients around reached the solubility test in the SHCs, and hydroxyurea and folic acid was given in the PHCs where the intervention was done because of the advocacy efforts with the district health system. And community of control PHCs lacked the knowledge of SCD, whereas in the intervention PHCs, at least 40% increase in the knowledge was seen. So based on this, we want to scale up this project to Anuppur, total Anuppur district. Here we have given this data, how many people we have screened, and at least now we have only in 2 cases 51 sickle cell patients. So based on that, we propose the scaling up of this project to the Anuppur district for training and capacity building of the government system for the same. And this is my last slide. It shows our different activities. And thank you so much for patient hearing. Actually, ma'am is unable to. Dr. Ruby Khan madam is unable to. She will join in 10 minutes. Okay? I will be in contact with her. Now I request. Dr. Shri. Yes, ma'am. Yes, ma'am. Yes, ma'am. Yes.
Hello, good evening. I'm audible to you?
Welcome, ma'am. Welcome. Yes, ma'am, you are audible, ma'am.
Thank you. Actually, I'm on the way. Actually, I'm going to Bhopal from Jabalpur, so might be due to the network condition, I may be like the network can go. That's why I wanted to connect. I want to congratulate you for this completion of your project. I am happy that you have started a very good project in Madhya Pradesh, where the capacity building and sensitization of the people there in a very small tribal district at Anuppur you have done. And I want to say something about the sickle cell project in Madhya Pradesh. Like we had started right back, like previously we were doing the screening at only health facilities, but the main challenges what we were facing was the lack of training and lack of awareness among the people as well as the so it is a big issue or big challenge when we are going for screening and management of sickle cell disease. So I think the main part for management of sickle cell is the community mobilization, awareness among the people, and the capacity building and the trainings of the health workers. So I think you have done a very good job there, where you have sensitized or where you have trained the people in the PSC and CSC. Now we had started in Madhya Pradesh. We have organized a Desh Hemoglobinopathy mission in NHM, under which we had started a pilot project on 15th November by the Honorable Prime Minister, and then we have started pilot project in Khabo and Alirajpur, and now we are doing screening and then again the confirmatory test and all management of sickle cell patients there. But very soon we want to extend this project to the other tribal districts of the Madhya Pradesh. So I think that we will coordinate with you. We will take the benefit of your experience, like how you have done the screening, how you have done the capacity building there. So I will complete you. I hope that I will take your help in the extension of the program.
Thank you, ma'am. Thank you so much.
Thank you. Yes.
Thank you so much for your kind words, ma'am. We will be ready to help you out in this, and we want to request you for the scaling up of this project and support us for the capacity building, because we have already shown you the pilot study and the results, how it is being helpful in Anuppur district. Even you can see I have some videos where Asha and ANM have presented before our Honorable Government of MP about the training they have got and how it is useful for the patients, ma'am. Thank you so much for your kind words, ma'am. Thank you so much. Thank you so much for joining even after being traveling. Thank you so much.
Thank you.
So now we have that was so kind of Dr. Rubicon ma'am for joining us, and I think now we have Archana Mishra madam, Deputy Director Maternal Health. She was also actually traveling. I will be connected with her. Now I request Mr. Prabhat Sinha sir. Actually, he has been looking at our project and how it is being run in these tribal areas. He was before with Novartis. Now he is head patient advocacy in Pfizer. But he was never disconnected with sickle cell patient groups, and he is the man behind even NASCO, that is National Alliance for Sickle Cell Disease Organization. And I am very happy to introduce you on this platform, Mr. Prabhat sir, who has been connecting all of us to different organizations that how capacity building of government healthcare system for sickle cell disease will be useful in India, not only in India, in international level. He has been encouraging us always. Sir, welcome on board, and over to you, sir.
Thank you, Dr. Sridevi and Dr. Bonta Babu sir and everyone. It's a real pleasure, and I think always whenever Dr. Sridevi does any program, you have to believe that there will be a lot of value, a lot of learning out of it. And I'm just a student, I'm learning, and I have to blame myself that for last 21 years I have been working in healthcare, But 15 years, this disease was invisible to me. So I have to make up in my next 15 years. So I try to, do whatever I can do little, and I want to learn. So, and this project I have been, this is like a book. You see certain things happening where it is needed, very minutely, and you learn so many things. And when you see a bigger program, bigger projects, there is always, you can pick and choose certain things. I have just made 3 slides so that I don't forget what I want to speak. So let me just see if I can share those. Or Dr. Sridevi, if you can help me to share, then. So what, I heard Dr. Sridevi and Mr. Babu. This program has 3 basic ingredients, what they shared in many of the slides. It was around the mission, the passion, and the compassion. For any program which happens with community, like tribal community, without mission, compassion, and passion, this cannot happen. Because ultimately this program is with a community which is very hard to reach. And 2-3 things what this, in a simple way, if I say, 4 things this project has done to me after listening. 1, this model has shown how to take care closer to the community. That is so important because for any other healthcare also, this tribal community was difficult to reach. Here at PHC, at a village level, care has been taken closer to them. The second, this is using existing healthcare system. It is not bringing something from outside. पहले गांव में कुछ बेचने के लिए बाहर से साइकिल पे आते थे, फिर वो चला जाता था, फिर हम वेट करते थे कब आएगा दोबारा. लेकिन भूख वेट नहीं करती है. And for sickle cell disease, enough screening program has happened across the country. But people who have come from outside to do screening has done screening and went. I don't know many places whether they have got a confirmatory report or not. When they went to screen, community was not supportive to them. There are many issues. Then they might have screened only 50% of the population. यहाँ पे वो साइकिल वाला नहीं, यहाँ जो अंदर दुकान वाला था उसको ही empower किया गया. People have been trained, and that is so crucial. These things looks very small, but this is very core. So using existing healthcare system. The third was empowering local health workforce, ANMs, these people who already have a trust with the community. This program has not contracted this screening to somebody else to come screen and go. This program believed on the existing healthcare system, ANMs, Anganwadi workers, medical officers, existing district staff, and thought of empowering these people. Now, these are very unique things for any program and especially for sickle cell program. Dr. Sridevi, if you can just project this in a presentation mode, because these are already very, very small slides. Now, lot of academicians, professors, and students are there on this call. And this particular slide is very basic. This is old one, but still these 6 building blocks I just want to reiterate. Many of you are already familiar with it, but whenever I have seen this program, I always started ticking mark that how this program is hitting on these 6 building blocks. And WHO long back very thoughtfully said that if you want to get an impact, if you want to get some outcome, you have to see that you hit on all these 6 building blocks, which is service delivery, health workforce, health information system, access to essential medicines, financing, and leadership and governance. Majority of the time in big program implementation, we focus on 3, 4, 5, we often miss 1, but it is like a machine. कि अगर टायर खराब है, इंजन कितना भी अच्छा है, गाड़ी नहीं चलेगी. गाड़ी कितनी भी अच्छी है, टायर में हवा है, बट डीजल नहीं है तो गाड़ी नहीं चलेगी. ड्राइवर नहीं है, एक्सीडेंट हो सकता है. So it's a very closely knitted machine where all these 6 building block has to be addressed. And then the access, coverage, quality, safety, everything will happen. And also very important is engaging with patients and patient groups. Then and only then we can be able to get where we want to achieve. Now if I go to the next slide, and how this project to me has started addressing this in a beautiful manner. And even today there was a very big meeting from where Dr. Ruby Khan is coming from Jabalpur, and I just watched the entire program. It just ended a few hours back. a lot of positives has started happening in MP. So if you see, Dr. Sridevi, if you go to the next slide, please. Anyway, so by the time it goes, see whatever she was discussing about this entire service delivery, how in this project block service has been delivered. There was a something not very new. Many times we feel that innovation means something new. Sometimes it is very basic. It already exists. It was using the existing healthcare worker, using those point of care at sub-center or PHC or CHC, giving these services. Second is health workforce. They all talked about this entire ANMs, ASHA workers, Anganwadi workers, how to empower them, how to train them so that they can do this simple solubility test. This need not to be done by a foreigner for that village who will come and do this solubility test and make people wait for months. We don't wait. We today in a time when we send a WhatsApp message, we try to see double tick aaya ki nahi. And for my small test, I will wait 2 months to know whether I have a trait or I have a disease. Health information system. So thoughtfully, they also kept these records so that the follow-ups and many things can be done, not a shorter period, but also on a longer term. Access to essential medicines. In this entire period, they have also ensured that it is not only screening. And I repeat, it is not only screening. Anyone who have been identified with the disease, they have been not only given a drug, but also counseled how to take this drug and why to take this drug. Otherwise, we have many screened, millions and crores of people identified, but I wonder what percentage of these people take hydroxyurea regularly. So, this access to medicine also has been ensured. Financing, to ensure that either the project makes those funding or generates those resources for this project. That is also so critical, and in a small project block here, I think ICMR has taken that lead and ensured that whatever resources was required was given. And then most important is leadership and governance. For any program, any pilot, any scale-up to happen, this is very crucial that there has to be a leadership and governance that exists. Now, Dr. Sridevi, if you can go to the next slide, if you can just move to the next slide, please. Yeah, yes. Now, what is being announced today? And that really excites me because you have a pilot which is ready with some fantastic results, and then you have a commitment from the state government to do something really big in state of MP, which has already been a state which has given some really demonstrated projects in the country. And now I think it's a turn of sickle cell disease. With Honorable Governor, Chief Minister, Health Minister, institutions, everything is there. I think sare masale hai MP mein, which can cook a beautiful project in this state. Now, what has been announced today? There are many announcements, but some I picked which relates to this health system framework is there has been a discussion, there has been an announcement of AIIMS Bhopal as a center of excellence, and also ensuring that every district hospital which is seen as a medical college will be a center of care or a point of care. They also signed an agreement, I think, between the ICMR institution in Jabalpur and Tribal Ministry and Health Ministry about building capabilities, which is so crucial. There was an announcement that there will be an online portal for patient registry. That means whatever is counted, that only those things gets delivered. And again, it's a very important point that now using digital web portal, ensuring that every sickle cell disease patient after screening is being counted, their data is fed in the system so that it can be linked with Ayushman Bharat, it can be linked with disability portal. There is a lot of linkages can happen. They also announced that drugs, vaccines for sickle cell disease patients will also be given in the entire state of Madhya Pradesh. Today only I was reading a very progressive PIP, what NHM, the approval what MP has got. And I think MP has done, I was reading the PIP, some of the very innovative things, whether it is daycare center at the district level, whether it is drugs, whether it is pneumococcal vaccine, I think they have provisioned for everything that is needed. And Dr. Ruby Khan, Dr. Archana Mishra, these are officials with a lot of heart. And I think especially Dr. Ruby Khan, I know for years she has been picking the best practices from different states. And this state, this year PIP reflects that how progressive this PIP is. And I think once everybody works together, all the outcome that has been thought for this project will be there. And the last but not the least, there was an announcement for state and district level task force. And I heard Minister and Health Minister, I think two minister or I'm really forgetting, but some very senior officials said that these state and district level task force will not only have doctors and institutions, but also people from society, patient groups, patient leaders, parents. They should also be part of this task force so that they can suggest, they can work together to make MP a model state. So I will stop here, and thank you, Dr. Sridevi and Dr. Bonta Babu, for inviting me. I will continue, learning from now the scale up what you will be doing in this entire Anuppur district. I think this district is fortunate to have an institution who has demonstrated, piloted, and shown the result. And I think this one district now will show path to many other districts in MP, in India, and I always say, Dr. Sridevi, that outside India also, because what you are doing is a big challenge for number of countries in Africa and even in Arabian countries. So nobody has cracked it. Nobody has cracked it in a community way. You have made a big dent. All the best to each one of you. And I'm sure success is just waiting for you. Not only for you, but I think for each and every sickle cell disease patient who is waiting at their doorstep to get the services. Thank you and all the best.
Thank you so much, sir. That was really good, and the way you have analyzed our pilot project and given in your words was really amazing. Thank you so much, sir, and thank you for encouraging all through our project and connecting us with NASCO, specifically NASCO and also the tribal ministry in the last meeting. Thank you so much for everything, sir, and I am sure though you are in Novartis or Pfizer or anything, as Mr. Prabhat Sinha, you will be supporting us through this project, and many more sickle cell patients will be benefited through capacity building, sir, because as you know, economic burden on the sickle cell patients is too much, and that can be addressed only by the government healthcare system, which was the vision of our mentor, Dr. Bonta Babu, sir. Thank you, sir. Thank you so much. Now I welcome our Chief Medical Officer of Anuppur, Dr. Suresh Chandra, sir, who has been always supportive for this project. Not only supportive, but also have really have taken many measures and helped us in the trainings of medical officers and also for the scaling up of the project also. Let us hear from his District Collector Madam Dr. Miss Sonia Meena is traveling, and she has given this responsibility of addressing our project to CMHO, sir. Now I welcome CMHO Dr. Suresh Chandra, sir, to tell few words about this project and the destination. Over to you, sir. I think he also has some connectivity issues. Welcome, sir. Welcome, Suresh, sir. सर आपका माइक म्यूटेड है सर. सर आपका माइक म्यूटेड है. Actually, he has also been traveling to Bhopal today because such an important day, Sickle Cell Day.
अरे क्या?
हाँ सर, बिल्कुल, बोलिए सर.
जी जी, सभी का स्वागत करता हूँ और जिले में है 400 के करीब पेशेंट हैं, तो दवा भी ले रहे हैं 13,000 करीब हमारे रजिस्टरिंग वाले हैं जी के लिए। इतना अच्छा काम हमारी टीम ने किया है कि कोविड के बावजूद भी 2020-21 में 14 हुई थी और 2021 में 11 हुई है। ये अच्छा काम शो करता है, कोविड के बावजूद ये चीजें हुई हैं। और मैं धन्यवाद देता हूँ ICMR को जिन्होंने अनूपपुर को चुना है। NHM से हमको मिलता संचालक जिले के कलेक्टर मैडम आज तो उनका थोड़ा सा सिग्नल प्रॉब्लम है, नहीं वो ज्वाइन, उनकी तरफ से मैं एक्सेप्ट करा दूं जितनी बार भी लोग मिला है, मोटिवेट किया और हर सहयोग किया। तो मेडिकल ऑफिसर अपने टीम के साथ तो हम लोग करना चाह रहे हैं कि अनूपपुर एक अच्छा मतलब सेंटर बने जिसमें एक काम है आदिवासी के नाते बहुत मतलब होता है हमारे साथ। और जो डिवोशन और डिटर्मिनेशन श्रीदेवी मैडम का है उससे हम 100% मैं ये एश्योर कराता हूँ कि हमारी टीम जैसा भी होगा 90% भी हमने स्क्रीनिंग कर लेंगे। तो इसलिए कोई अनुमति नहीं है कि हम उसको नहीं कर सकते हैं, करेंगे और 100% करेंगे। और सिकल सेल में क्या है, हम डेथ नहीं रोक सकते, केस नहीं, लेकिन उनके ड्यूरेशन ऑफ लाइफ को बढ़ाने के लिए हम जितनी भी सारे पैरामीटर्स पे काम करते हैं, चाहे वो टेलीमेडिसिन हो, चाहे कोविड में हो, वैक्सीन में हो। और अभी हम 12 और 14 में हम 3rd पोजीशन पे हैं स्टेट में। तो इसलिए मैं कह रहा हूँ कि अगर हमारी टीम एक्टिव है तो हम उस चीज को करना ही है, मुझे उसमें कोई नहीं। एक मैडम से हमारे फोलिक एसिड 2021 में 183 पेशेंट को फ्री या विदाउट एक्सचेंज ब्लड चढ़े सिकल सेल के पेशेंट को, और डेथ भी कम हुई है, ड्यूरेशन ऑफ लाइफ है। अलग से एक 6 बेड का सिकल सेल वार्ड जिला अस्पताल में बना है। तो हमारे डॉक्टर्स रेगुलरली मॉनिटर कर रहे हैं, देख रहे हैं। तो मैं श्रीदेवी मैडम को सभी लोगों को धन्यवाद देते जाता हूँ। अनूपपुर जिले में जो भी टारगेट जो हो सकता है 100% कोशिश करके और उसको सही रिजल्ट दें। हमें ऐसे की जरूरत है, ऐसे कलेक्टर मैडम का हमको मिलता रहता है, किसी भी चीज की कमी है तो हम इसको कर लेंगे। कोई भी इशू अनूपपुर से नहीं आएगा सिकल सेल को लेके कि हम ये चीज कर पा रहे हैं। हमारी टीम बहुत अच्छी है, बहुत डिवोट माइंडेड डॉक्टर हो या कोई भी हो, तो हम इसको करेंगे ही। बस आप लोग मार्गदर्शन दे देंगे, मैं करवा लूंगा। थैंक यू।
थैंक यू सो मच सर, बहुत बहुत धन्यवाद सर। हम लोगों के साथ आप ट्रैवल करते हुए भी जुड़े और हमारे लिए बहुत अच्छे शब्द बोले और हमेशा आपने हमारा सपोर्ट किया है। ऐसे ही अनूपपुर जिले के सभी ANM और लैब टेक्नीशियंस को प्रशिक्षित करने के लिए हमें आपका पूरा सहयोग मिलेगा करके ऐसा हमारा आशा है। और हम सभी मेडिकल ऑफिसर्स के साथ हम काम करना चाहते हैं। जो भी मेडिकल ऑफिसर्स, DMO सभी लोग आज जुड़े हुए, सभी को धन्यवाद। आपके टीम लीड भी बहुत अच्छे हैं, वो है सुरेश सर। सर इस प्रोजेक्ट को हम अगर पूरे अनूपपुर डिस्ट्रिक्ट में कर सकते हैं, हम लोग सिकल सेल डिजीज का अभाव बिल्कुल ही कम कर सकते हैं अनूपपुर डिस्ट्रिक्ट में। एंड हम लोग ऐसा एक पायोनियर डिस्ट्रिक्ट बना के इंडिया में दिखाएंगे, नॉट ओनली इंडिया, इंटरनेशनली हम लोग दिखाएंगे कि एक लो सेटिंग्स में स्क्रीनिंग ट्रीटमेंट सिकल सेल डिजीज का हो सकता है करके। अगर आप सुनेंगे, जैसे अभी नैस्को से हमारे साथ गौतम जी हैं जो अभी बोलने वाले हैं, वो कहीं प्लेटफॉर्म पर, इंटरनेशनल प्लेटफॉर्म्स पर देते हैं सिकल सेल डिजीज का कितना बर्डन है एंड सभी लोग कैसे जूझ रहे हैं। ये कैपेसिटी बिल्डिंग ऐसा एकमात्र आइडिया है जिससे हम लोग पूरा सिकल सेल डिजीज ही कम कर सकते हैं, क्योंकि ये मैनेज, इसको हम मैनेज कर सकते हैं सर। थैंक यू सो मच सुरेश सर। फिर एक बार आपको बहुत बहुत धन्यवाद सर। थैंक यू सो मच सर।
Thank you.
Before just going to, before listening to Gautam sir, who is secretary of NASCO, I just want to show few seconds of video where we have presented, not only presented our project before Honorable Governor sir, Shri Mangubai Patel ji of Madhya Pradesh, but also हमने थोड़े आशा एंड एएनएम्स को उनके सामने लाया था, जिन्होंने वो कैसे प्रशिक्षित हुए एंड कैसे पेशेंट्स को यूज हुआ था। ये आपको बस 2 सेकंड में आपको हम एक बार दिखाएंगे। Actually, there is an error in playing this video. I think only you can listen to it. Sorry, I was unable to play the video. But it was that in November, Honorable Governor of MP Shri Mangubai Patel have reached out to IGNTU and heard to our project and congratulated us for such a big program, and also have met the ASHA and ANM who had got the training of solubility test and also the lab technicians. And that was that idea was also shared by him to Honorable Prime Minister of India, Shri Narendra Modi ji, to whom we have written several times, and also a note was taken from Anuppur district on how capacity building can improve the management of sickle cell disease in India. And after that only there was an inauguration of sickle cell screening all over Madhya Pradesh, which even most of us know, and even Rubika Madam also knows about the program which is going on. Today our Mr. Prabhat sir was telling these, after that only these all were taken, the decisions were taken about the capacity building, and we are very happy that our ideas or Dr. Babu sir's idea have reached many people through our programs, through Governor sir, or through whoever it is. We are very happy that in some way our ideas have reached that sickle cell disease can be managed in the tribal areas through capacity building. We are very happy for that. That itself is making us successful in this pilot project, but still we would like to do the scaling up project in Anuppur district and hope we will get the support. Now over to Mr. Gautam Dongre sir. Let me tell you about him. He is actually a caregiver for a sickle cell disease patient, but he never stopped his enthusiasm, or he never stopped his efforts working for sickle cell disease patients, and he has put many patient organizations together under the umbrella of National Association for Sickle Cell Disease, and has been meeting, doing advocacy efforts all over India, talking to tribal ministry people, talking to every governor of honorable governors of the states regarding sickle cell disease and why it is a disease. That this disease is not only about some genetic disease, it is also about the pain and distress they undergo, the patients undergo throughout their life if they do not get the proper treatment, or if they don't get diagnosed. And many platforms, many people I have been hearing that prenatal diagnosis will be helpful, or many other things, but then what we advocate was understood by NASCO that the capacity building is very important, mainly for the poorer or the tribal or rural areas for managing this disease. Over to you, Gautam sir. Welcome to you.
Thank you. बहुत बहुत धन्यवाद डॉक्टर श्रीदेवी मैडम, डॉक्टर बोंता बाबू सर कि आपने एक मौका दिया पेशेंट ऑर्गेनाइजेशन को अपनी बात रखने के लिए। थैंक यू कहूँगा प्रभात सर को, जिन्होंने हमें आज काफ़ी हर समय में हमें गाइड करके पेशेंट की वॉइस को आज आप लोगों के सामने बोलने लायक बनाए। साथ ही यहाँ स्वागत करूँगा डॉक्टर अर्चना मिश्रा मैडम, डॉक्टर रूबी खान मैडम और आप सभी एक्सपर्ट्स लोगों का मैं पेशेंट ग्रुप की तरफ से बहुत बहुत स्वागत करता हूँ। सिकल सेल डिसीज आप सभी उस पर काम कर रहे हैं, और मुझे ये गिफ्ट मिला पहले बच्चे के साथ में। उसके बाद से आज तक जो 17-18 साल का समय है, ये समय बिताते समय ऐसा लगा कि मानो कोई सजा मिल गई हो। चूंकि मैं पेशेंट ऑर्गेनाइजेशन से हूं, तो मैं आज अपना पेशेंट पर्सपेक्टिव यहाँ रखना चाहूँगा कि उनके साथ एग्जैक्टली क्या होता है, क्यों होता है, और जिस चीज़ को आप आज सक्षम हुए हैं रोकने के लिए, उसकी भारत देश में कितनी ज़रूरत है। बहुत कम शब्दों में बताऊंगा, ये सिकल सेल डिसीज बहुत ही पीड़ादायक है। कहते हैं ना हम आम भाषा में कि हमारे दुश्मन को भी ये ना हो, तो मैं भी यही कहूँगा कि हमारे दुश्मन को भी ये रोकना, क्योंकि अगर एक घर में सिकल सेल पीड़ित होता है तो वो घर इकोनॉमिक और सामाजिक दृष्टि से भी कट जाता है और उसका हर तरह से ग्रोथ खत्म हो जाता है। इसके अलावा वो देश के किसी भी तरक्की में पार्टिसिपेट नहीं कर पाता, क्योंकि या तो वो घर में होता है या हॉस्पिटल में होता है, न सिर्फ पेशेंट बल्कि उसका पूरा परिवार। तो भारत में 14 लाख जो कि टेस्टेड सिकल सेल पेशेंट आज है, तो 14 लाख फैमिली को हम मान के चलते हैं। ये कोई छोटा अमाउंट नहीं है, नंबर नहीं, बहुत बड़ा नंबर। इतने सारे परिवार आज तकलीफों में जी रहे हैं, इन्हें हम बहुत आसानी से रोक सकते हैं। जो आप लोग एक्सपर्ट हो और आपने जो आज ICMR और इंदिरा गांधी ट्राइबल नेशनल यूनिवर्सिटी ने मिलकर के जो काम किया है, ये काम अगर 20 साल पहले अगर शुरू हो जाता, ज्यादा नहीं तो हमारे यहाँ भी शायद सिकल सेल के बच्चे नहीं आते। लेकिन आने वाले समय में ऐसे कितने ही परिवारों के घर में सिकल सेल के बच्चे नहीं जाने वाले हैं, उसकी दुआएं आप लोगों को लगेगी। क्योंकि जो अनूपपुर में, जो डिस्ट्रिक्ट में ये जो पायलट प्रोजेक्ट चला है, क्योंकि डॉक्टर श्रीदेवी मैडम से हम लोग पिछले 2 से 2.5 साल से टच में है और वे हमारे नेशनल अलायंस ऑफ सिकल सेल ऑर्गेनाइजेशन नेस्को के सीनियर एडवाइजर भी है, तो हम जानते हैं कि किस तरह से उन्होंने इस प्रोजेक्ट को चलाया है और जो कि हमारा पेशेंट ग्रुप का एक ड्रीम प्रोजेक्ट है। भारत के 14 स्टेट में सिकल सेल डिसीज का बहुत प्रेवलेंस है। हम मानते हैं ट्राइबल्स एरिया में है, लेकिन जब हम बाहर काम करते हैं तो ट्राइबल्स के बाहर भी हम इसे देखते हैं। 80 जातियों में हमने सिकल सेल डिसीज को पाया है। तो ये प्रोजेक्ट अगर ट्राइबल से शुरू हुआ है तो मैं चाहूंगा कि भारत के हर डिस्ट्रिक्ट में जाए और सभी कम्युनिटी में स्क्रीनिंग हो, क्योंकि हमें पूरी तरह से भारत को सिकल सेल मुक्त करना है। और ये इस प्रोजेक्ट ने बता दिया कि हम बिल्कुल ही आसानी से कर सकते हैं। बहुत बड़ा इसके लिए कोई मैनेजमेंट की, मैन पावर की जरूरत नहीं, जो है एग्जिस्ट है, हम उन्हीं के साथ इस चीज को आसानी से रोक पा रहे हैं। जब हमने नेस्को के लिए स्टोरी बनाई थी अनूपपुर के एक आशा वर्कर की, तो मैडम 32 साल के बाद वो डायग्नोस हुई, जो कि आप सभी जानते हैं सिकल सेल डिसीज बचपन से ही होता है पीड़ाओं के साथ में। लेकिन हमारे भारत के मध्य प्रदेश के अनूपपुर डिस्ट्रिक्ट की एक आशा वर्कर खुद डायग्नोस होती है इस प्रोजेक्ट के बाद। तो ऐसे कई सिकल सेल पेशेंट आज भी राजस्थान, आसाम, महाराष्ट्र, छत्तीसगढ़, मध्य प्रदेश और ऐसे कई राज्यों में रास्ता देख रहे हैं कि उनकी बीमारी को सिकल सेल डिसीज का नाम मिले, क्योंकि वो उसमें सरवाइव कर रहे हैं, बट उनको अभी तक पता नहीं चल पाया है कि वो सिकल सेल डिसीज में है, क्योंकि उनका प्रॉपर स्क्रीनिंग नहीं हुआ, डायग्नोसिस नहीं हुआ, और ये दोनों चीजें नहीं होने से उनको प्रॉपर ट्रीटमेंट नहीं मिल रहा है। और चूंकि नेशनल और इंटरनेशनल काम करते हुए पाए हमने कि तीसरे से चौथा बर्थडे भी सिकल सेल बच्चे बहुत मुश्किल से देख पाते हैं जिनका डायग्नोसिस समय पर ना हुआ, क्योंकि उन्हें प्रॉपर ट्रीटमेंट, प्रॉपर वैक्सीनेशन जब नहीं मिलता तो उनका बचपन में ही मोर्टेलिटी रेट बढ़ जाता है। इस तरह से हम देख रहे हैं कि ये प्रोजेक्ट आम पेशेंट के लिए, ट्राइबल पेशेंट के लिए कितना ज़रूरी है, जो कि हॉस्पिटलाइज नहीं हो पाता, कुछ दर्द हुआ तो उसे घर में ही मैनेज करना होता है, उसके पास साधन नहीं होता कि PSC तक भी जाने के लिए। ऐसे ऐसे एरिया में रहते हैं कि जहाँ से वो पहुँच नहीं पाते, और उन एरिया में जाकर के अगर ये प्रोजेक्ट उनके डोर टू डोर स्टेप में जाकर के काम कर रहा है, तो ये रियल प्रोजेक्ट है जिसकी पूरे भारतवर्ष में बहुत आवश्यकता है। मैं नेशनल अलायंस ऑफ सिकल सेल डिसीज ऑर्गेनाइजेशन नेस्को की तरफ से, सारे पेशेंट ग्रुप की तरफ से विनंती करूंगा कि ये प्रोजेक्ट भारत के कम से कम 14 स्टेट में एटलीस्ट शुरू हो जाए, जहां सिकल सेल का बहुत प्रेवलेंस है। आप लोगों की हमें बहुत जरूरत है। हम सब आप लोगों की रास्ता देख रहे हैं। कि किस तरह कब आप आए और डायग्नोस करें और हमें प्रॉपर ट्रीटमेंट दें। ट्रीटमेंट भी बहुत इकोनॉमिक है, हाइड्रोक्सी यूरिया से 70 to 80% पेशेंट मैनेज हो रहे हैं। अगर उसका प्रॉपर डोज मिले तो हम देख रहे हैं कि लोगों का लाइफ ऑफ स्टैंडर्ड थोड़ा सुधर रहा है। तो ये बहुत इकोनॉमिक और बहुत सस्ता इलाज भी है, बस सिर्फ जानकारी की कमी है, उन तक एक्सपर्ट के पहुंचने की कमी है, जो कि आपने आशा वर्कर और एएनएम और पीएससी लेवल ये जो ऑलरेडी एग्जिस्ट है, इनके सहारे से आपने पेशेंट्स को ढूंढ निकाला, उनको आज नई जिंदगी दी। मैं ग्लोबल अलायंस ऑफ सिकल सेल डिसीज ऑर्गेनाइजेशन में भी बोर्ड मेंबर हूँ और अब से सिर्फ आधे घंटे के बाद में हमारी एक ग्लोबल वेबिनार है और मैं डेफिनेटली आपके इस प्रोजेक्ट को इस मीटिंग में जरूर रखूंगा और उन्हें बताऊंगा कि किस तरह से हमारे इंडिया में ये प्रोजेक्ट रन हुआ है और उसके क्या रिजल्ट्स है। और इसी के साथ मैं चाहूँगा कि आप ऐसे ही इस काम को आगे बढ़ाएं और हमारे साथ बने रहें मैडम। हम सारे पेशेंट की तरफ से मैं फिर से एक बार ऑर्गेनाइजर्स का, डॉक्टर श्रीदेवी मैडम, बोंथा बाबू सर, प्रभास सर और जितने भी एग्जिस्ट है सभी मेंबर्स का मैं बहुत बहुत धन्यवाद देता हूँ। और कोशिश करते हैं कि जो आज हम मना रहे हैं सिकल सेल दिवस, विश्व सिकल सेल दिवस, ये हम आने वाले 10 से 15 साल के बाद बिल्कुल ना मनाएं। हमें बिल्कुल नहीं मनाना है ये दिन, हमें टोटली भारत को सिकल सेल मुक्त करना है। पेशेंट ग्रुप को मौका देने के लिए बहुत बहुत धन्यवाद। थैंक यू सर।
थैंक यू सो मच गौतम जी, थैंक यू सो मच हमारे साथ जुड़ने के लिए। एंड आपने जिस तरह बोला आने वाले 20-30 सालों में नहीं, मैं तो चाहती हूँ आने वाले थोड़े ही सालों में ये दिन हम ना मनाएं एंड सिकल सेल पेशेंट्स कोई ना रहे एंड सभी का मैनेजमेंट होते रहे, जितने भी अभी पेशेंट्स है बस उनका मैनेजमेंट होते रहे। एंड मैं सभी को ये प्लेटफॉर्म पर बोलना चाहती हूँ कि हम लोग जो काम कर रहे हैं, जो काम बोंता बाबू सर ने स्टार्ट किया है, ये तो जस्ट ड्रॉप इन द ओशन है, मगर आप लोग जो काम कर रहे हैं वो तो बहुत ही सराहनीय है। आप सभी लोग नेस्को का काम देखें एंड उनको सपोर्ट करें। मैं ये चाहती हूँ ये प्लेटफॉर्म पर एंड आप हमारे प्रोजेक्ट को सपोर्ट करने के लिए एंड इसका जो कार्य है वो ग्लोबल लेवल पर भी इसको प्रोजेक्ट करने के लिए आपको बहुत बहुत धन्यवाद सर एंड हमने हमारे साथ जुड़ने के लिए आपको बहुत धन्यवाद सर। थैंक यू,
बहुत बहुत धन्यवाद। थैंक यू सर।
सो इसी के साथ हम लोग ये कार्यक्रम के एंड पर पहुंचे हैं, मगर धन्यवाद ज्ञापन के बिना कोई भी कार्यक्रम अधूरा रह जाता है। मैं आज जितने भी लोग हमारे साथ जुड़े एंड बोले हैं उनको धन्यवाद बाद में करूंगी, मगर मैं अपने खुद के स्टाफ को पहले धन्यवाद करना चाहती हूँ जिन्होंने मेरे साथ मुझे झेलते हुए ये काम इतना, मैं आपको बताना चाहती हूँ अमरकंटक ऐसा एरिया है, इट इज above 600 meters or above sea level and it is very difficult area to work. And let me tell you, when we have started the project sir, we COVID started. As soon as we started our formative research, we have started. It started with COVID, and in that time also, my project staff never stopped going. And मैं उनका और भी सलाम करना चाहती हूँ because they even helped in COVID times in helping the tribal people about the COVID का लक्षण क्या है, उसके लिए क्या करना चाहिए, उनको जो भी सामग्री था, जो भी हमारा जितना हेल्प हुआ वो भी कर रहे थे while doing the formative research, that is household surveys and all the interviews. मैं आपको परिचित करना चाहती हूँ डॉक्टर S.L. बालकृष्णा। He is scientist C in our project and he has worked before in ICMR Datia for on Saharia tribes for thalassemia disease also, and then he has joined our project for sickle cell disease. He is the person who has जो बाबू सर का आइडियाज था उसको कैसे ये ट्राइबल एरिया में कौन से क्षेत्र में कैसे जाना, इसको कैसे करके दिखाना है, he was the person who was behind this. And he used to visit all the field along with the team, and he has done a wonderful job. I congratulate Dr. Balakrishna for doing such a wonderful job along with our team. And I congratulate Mr. Vikas, who is the voiceover of the documentary, and also he has done a great job, because without him this was not possible. And I congratulate Miss Shweta Gupta, Mr. Lakshmikant Marco, who is the lab technician and research assistant in our project, and now with us is Mr. Dhirendra Kumar. So I thank, तहे दिल से मैं अपने स्टाफ को ये प्लेटफॉर्म पर थैंक करना चाहती हूँ. And because we are, and one more person whom I have to thank is Dr. Yogita, who is working from Delhi and coordinating all the sites with lot of patience, and has been collecting the data and making and जहाँ तक भी हमारा डेटा है, हमारा काम है उनको पब्लिकेशंस तक पहुँचाने में, and हम सब लोग को कोऑर्डिनेट करने में डॉक्टर योगिता has really played a very good role. Thank you, ma'am. Thank you for being with us. And I especially thank today our special guest is Professor Kusuma ma'am from AIMS. She is professor in community health, and she has supported us, not only supported from behind, and she is with us today. She has also been giving us ideas for this project, and thank you so much, ma'am, for being with us. Now I thank all the personalities who were with us, Honorable Vice Chancellor Shri Prakash Mani Tripathi sir, and I should not forget our ex-Vice Chancellor Professor T.V. Kattimani, who has helped me in starting this project till the trainings, all the trainings were done, and the first phase he was there with us, and he has supported us a lot. And then Professor Shri Prakash Mani Tripathi. Then I should not forget Mr. Chandra Thakur sir, who was district collector of Anuppur, who has helped us. During the initial stages of the project. Now it is Miss Sonia Meena. She could not join us, but she is very supportive, and she is also supporting us for the scaling up of the project. And I thank Dr. Rubichan Madam, Dr. Archana Mishra from National Health Mission of Madhya Pradesh for taking up our ideas, and also helping us and supporting us for the scaling up of the project. And I especially thank Dr. ex-CMHO of Anuppur district, Dr. Srivastava sir, and now Dr. Suresh Chandrai sir, for continuously supporting us for this project. Without your help, it was impossible, sir, because whenever I wanted permissions for trainings of ANM, ASHA and medical officers, they were the persons right away giving permission. Please, Sridevi, you take them and train them. And thank you so much for that, sir. आपको बहुत धन्यवाद, sir. And Mr. Prabhat sir, मैं जितना भी बोलूँ ये प्लेटफॉर्म बहुत कम है. I can't tell you how he has been supportive and in reaching Ministry of Tribal Affairs and people. I'm sure जितने भी आज they have taken decisions on sickle cell disease, I am sure it has been influenced by National Task Force project of ICMR. I congratulate Bonta Babu sir for this, and Prabhat sir especially for making our voice reach there. Thank you so much, sir. And last but not the least, Gautam Dongre sir, you are so kind to be with us, but what you are doing is of immense, little congratulations is very much small. You are doing a great job. I know personally how much you are working hard. You are with us, sir. Please take our help, and even Babu sir is with you. Please be taking our help for NASCO's any work, sir. We will help out you with the community and IEC material. I have spoke to Bonta Babu sir regarding the IEC material. He is ready to help out, and also we made the treatment protocol. If you want, we can share with you. We are with you, sir, totally.
Sure, thank you so much.
Sensitivity towards sickle cell patients have made this project. So that we are ready to help you, sir.
Thank you so much, sir.
And I thank all the medical officers, ANM, ASHA, who have been supporting us, taking the trainings and being with us today also on the last day dissemination of my project in Anuppur district. And I am very, very, very thankful to you. जितना भी thanks धन्यवाद आप सभी लोग को बहुत बहुत धन्यवाद. And ANM sir were so nice on immunization day. It is very hectic, let me tell you. I have seen with my own eyes on immunization day, Tuesday and Friday, they are very, very busy. But हम लोग solubility kit लेकर जाते, वो 25 patients आशा दीदी लोग लाते, and then ANM used to do it. And आपको कितना भी धन्यवाद बोलूं बहुत कम है मैडम. आप लोग बहुत अच्छा काम कर रहे हो. एंड हम लोग को ऐसे ही सपोर्ट करते रहो और प्रशिक्षित हम करते रहें. थैंक यू सो मच एंड थैंक यू सो मच टू ऑल ऑफ यू हैव बीन पेशेंटली विद अस लिसनिंग टू दिस. Thank you Dhiren for live streaming on YouTube, and thank you Bharti for helping us with live streaming. Thank you. With this I end the program. Thank you.